Hello, I'm Dr. Lydia Knudsen. I'm a chiropractor and the Executive Director of the Lydian Center for Innovative Medicine in Cambridge, Mass. I'm here to talk to you today about chiropractic and pregnancy and how chiropractic might fit into your total health care during pregnancy. The first reason why you might see a chiropractor is for those aches and pains that are bound to crop up as your body grows and gets bigger and the whole biomechanics of moving around changes. The pelvis is the center of gravity for all of us, and any woman who is pregnant understands how important that pelvis is in giving a healthy, normal vaginal delivery. It also is important in stabilizing the body as you move through space. As your body changes, becomes larger, it becomes more and more difficult to get around. As that weight increases, you often experience back pain, neck pain, knee pain, ankles, feet swelling, all of that. I recommend that you make a relationship with a chiropractor before you actually get pregnant so that as those aches and pains come up, you can get some help, relief. Chiropractic can be very effective for relieving aches and pains musculoskeletally. The other reason to see a chiropractor is that a stable pelvis is imperative for an easy, safe delivery of a baby. If the pelvis is slightly twisted, either the right side's twisted back or the left side's twisted back, you can see how biomechanically it's more difficult for the baby to fit down through that pelvis. I had a patient come in who was 6 months pregnant with her second baby, and she had read in some obscure website that chiropractic might be able to help her. The first baby had ended up in a cesarean after getting hung up on the pubic ramus. So she came in, and indeed the twist in her pelvis was exactly how the obstetrician had described that baby getting hung up. So we stabilized her pelvis, and the second baby was beautifully delivered, easy vaginal delivery after that. She came back in after that second delivery, and in fact the pelvis was perfectly stable and she was pain-free. So here's a plastic model of the skeleton and the pelvis. This is the pelvis, a beautiful ring structure through which the baby must pass in order to have a natural vaginal delivery. There are two joints here, the sacroiliac joints. If there has been instability in those joints, you can have the right side twisted back or the left side twisted back. If that happens, it tends to pull up the pubic ramus either on this side or on that side. When this distorts and becomes torqued, you can see how this opening here, the pelvic opening, becomes compromised. By stabilizing and straightening out the sacroiliac joints, it creates the widest and most ovoid opening that the pelvis can have.
Hi, I'm Eve Kodiak, and I work here at the Lydian Center as a craniosacral therapist and brain gym consultant and sound healer. I'm a musician, and I work with women who want to become pregnant and women who are pregnant and want to set intentions for a wonderful birth. And I do classes for pregnant moms and their babies. And one thing that's important to realize about being a mom is that your baby learns everything from you. They learn what it is to be a person from you. And so the kind of person you are while you're pregnant is the kind of person your baby is learning how to be. So if you're happy and peaceful and loving through a lot of your pregnancy, your baby will learn that that's the way they need to be too. And so it's important to minimize the stress and anxiety and rushing around that we often do in our lives. I mean, you can't completely change your life. Most people need to work up through the pregnancy, but you still can intersperse these quiet, happy moments into your day, not sweat the small stuff, keep your anger down to a minimum. If you have anxieties and fears, you set positive intentions and deal with them in an appropriate way, and really set a lot of peaceful time to communicate with your baby. There's a psychologist, John Gottman, who some years ago did some research on what makes marriages work, and I think it's true for any relationship. And what he came up with was a 5-to-1 ratio of positive to negative interactions. So if you're stressed out for 10 minutes while you're pregnant, then realize that you need to set aside 50 minutes to be happy. So take a bath, do some yoga, take a run, read a book, sing. And singing is so important because even if you think you have a terrible voice, your baby loves that voice. Your baby loves that voice more than any other sound in the world because it's you, and your baby loves you more than anything else in the world. So sing to your baby.
You were working with this baby before she was even born, right?
Oh, I do. Yes, I did.
Yeah.
Right before the pregnancy, we did some intentions, I think, about the birth itself, and that it would go smoothly, and it went amazingly smoothly. Just an hour and a half, and she came out, and it was a completely natural childbirth.
Good morning. This is Miranda bringing you a homeopathic moment. And I'm here this morning to talk to you about pregnancy, how homeopathy can help tremendously with all sorts of little aches and pains and the kinds of things that really you don't want to take to your doctor, you don't want to take medicines for. You want something that's going to help, though. Morning sickness can completely overshadow the joy of pregnancy. It can make life hell. And homeopathy has a tremendous number of very effective solutions. My number one favorite remedy for morning sickness is Sepia. Sepia 30C will work where the symptoms of morning sickness are alleviated by eating or drinking something. Women who have this kind of morning sickness, and it's the most common form, find that they gain way too much weight in the first trimester because they're always chomping on something, especially sweet things, chocolate, pickles. These are all the kinds of mad things they crave in early pregnancy. Sepia will quickly restore the pregnant woman who's suffering from this kind of morning sickness to health, and it will alleviate also her feelings of tiredness, irritability, any kind of other discomforts that she's experiencing at that time. Of course, it isn't the only remedy, but it's the main one. In my book, I cover all the others, or many of the other remedies. So if this doesn't quite fit your symptoms, have a look further for the other ones. My other favorite I have, there's a funny little symptom that happens in pregnancy with the active babies. Some, you just know they're going to come out and go straight to the trampoline or become gymnasts. So I had a patient come in and tell me she was sure she had a footballer in a little boy. She didn't know whether it was a boy or girl, but she was sure it was a little boy. She was right, as it happens. And she was equally sure that he was going to become a footballer. She said she felt her whole abdomen felt bruised and sore from him kicking her. She was about 4 or 5 months pregnant, and she was actually in a sorry state from it. She had trouble getting up and moving because her whole abdomen was so bruised. Arnica 30C, this is every homeopath's favorite remedy, number one remedy for injuries to the soft tissues. It works like a dream, and within a couple of days, her poor bruised belly was back to its strong, healthy self. Her baby did carry on kicking, and she had to keep the Arnica on hand and take it from time to time through the pregnancy when he got too vigorous. Arnica is also, by the way, my number one remedy for after the birth, for helping to heal from all the injuries to the soft tissues, any bruising to the pelvic area, whether it's a normal vaginal birth or a C-section. Arnica will help to quickly bring down the swelling and help to heal. Like all homeopathic remedies, they're perfectly safe in pregnancy, after childbirth. Then there's no toxic residue, no danger of side effects. Homeopathy is a form of energy healing, and it's completely safe for pregnant and newly delivered mothers and babies. My third remedy that I'm particularly fond of in pregnancy, and this is for a funny little complaint that is fairly frequent in the third trimester, is that horrid little giddy up, that pain that women get in the groin when the baby becomes big and or the head engages and they're walking along and suddenly, boom, they fall down. It's like this shooting pain goes up through the top of the thigh and they have to sit down for a few minutes, 5-10 minutes, until the pain passes, and then they're hobbling for a while. It's really unpleasant. Bellis perennis will heal that like a dream. It works really quickly in a 30C. Of course, they should have it in their handbags, in their purses to carry, so they've always got it at hand. And just take a dose or two immediately afterwards. It's also, by the way, a wonderful remedy after childbirth if Arnica helps. But the deeper ligaments, the bruising is deeper and more serious once the swelling is gone. If the pain is still there, Bellis perennis will help to heal that.
For more information about natural healing at home, with DVDs and online courses, please see our website, greenhealing.org. This excerpt is from our show, A Healer in Every Home. You can see more clips on the Green Healing TV channel on YouTube. Please help us to spread the word about how families can use natural healing at home. Ask your local community access station to air A Healer in Every Home. They can easily download it from PEG Media. Thank you.